All right, good morning. I'm Mark Pinto here with you from Phoenixville Public Library, and welcome to the library's latest Community Services Spotlight. Today we shine a light on the Clinic of Phoenixville. For nearly 20 years, the clinic has provided quality medical care and wellness counseling to the uninsured and underserved. And with us this morning is Lou Osterhoudt, who is Executive Director of the clinic. Lou, thanks so much for being with us this morning.
Oh, it's a pleasure. Thank you for the opportunity to be here. We're really looking forward to telling our story. We love to tell our stories, so thank you. Do you want to get started or you want to wait a little more?
Yeah, go ahead.
Oh, I'm sorry. Okay. Probably what I'd like to do is introduce Beth Flora, our development director first. She's been our development director pretty much a little longer than I've been executive director. So we've kind of got to know the clinic really well together. So it's been great and moved in a great direction. So what we'd like to do today is kind of give you some background on where the clinic come from, how it started, show this beautiful building we're in, how it became that way, and our plans going forward, and then give you some numbers. We are a 501c3 nonprofit, and as you'll see, we rely heavily on donations. So the more we can get the word out about the great work that's going on here, the more support we tend to get. So we appreciate the opportunity. So if it's okay, I'll just start sharing my screen. Hopefully this comes in there. Scheduling made easy. Are you seeing my screen? What are you seeing?
Yep, you can see it.
You're seeing the PowerPoint?
Yes.
Okay, good. So appreciate this presentation today. As I said, what I'd like to do is figure out how to get the next slide. Hold on. Okay, there we go. There's a picture of the clinic. If you don't know who we are, where we are, you may recognize this building. It's on Church Street, right between the Senior Center and St. Peter's Episcopal Church. It's actually a mansion that was built by the Reeves family back in the 1860s, Reeves being one of the owners of Phoenix Steel. He built two of these, one right across the street from each other, for his sons. And so it was occupied by the family for quite some time. And then the family moved on, or the sons moved on. And I think they built larger houses as they want to do. But anyway, it was donated to the church along with the land. So it's now owned by St. Peter's Episcopal Church, and they used it as a rectory for years, and which was great because, it's obviously a great asset that they could use for a lot of things. However, it was an old property. And so, as it starts to get on to 100 more years old and hadn't been really significantly updated in that time, the keeping it open became really unworkable. So they decided to close it. They closed the rectory. They basically boarded up the windows, locked the door, turned off the water and the gas and the electricity, and let it sit. And there it sat for a number of years. And a new rector came to the church, Reverend Mother Marie Swayze, and she had a friendship in town with a doctor, Dr. Lorna Stewart, who had a family practice for over 20 years, number of years here in town. A very, very popular family doctor here. And she had been frustrated as her practice had gone on, and she was trying to find ways to overcome the barriers that were happening, especially to the disadvantaged in our community, because if they didn't have insurance, well, you didn't really have much access to health care. And so she also was tired of the interference that was becoming more onerous from the insurance companies that weren't allowing her to practice medicine the way she felt it needed to be practiced, limiting the time, limiting the tests you could run, limiting the types of drugs you could prescribe. So she really just got tired of that interference. So she, Dr. Stewart and Reverend Marie, Mother Marie, were sitting on the wall between the church and the clinic looking at the building. And, Reverend Mother says, we can't afford to tear it down. We can't afford to open it up. We don't know what to do with it. And Dr. Stewart says, you know what? I'm going to open a free clinic there. And they said, Mother Marie said, okay. And she got the Episcopal Church to agree to it. And Dr. Stewart went on a campaign to try and find money to renovate. So what they started with, well, first off, let's say it was founded in 2001. So all this happened around the turn of the millennia. They founded the 501c3 in 2001, started looking for money. They were able to basically start because Dr. Stewart was telling a story to a friend of hers who wrote her a six-figure check. So there they had the seed money to try and raise the $500,000 they needed to convert this into a medical clinic. So she just went on a fundraising campaign, contacted everybody she knew, ran all kind of fundraisers, and that led them to get to be to find the money to make it happen. So they started the campaign and opened their doors in 2002. So, you know, we're very much looking for our 20th anniversary next year, having a great big celebration for this. So these two remarkable women did this, and there they are. You know, you can probably guess who Mother Maria is and who Dr. Stewart are, but tremendous, tremendous people, very gutsy, very smart, very driven, and converted it to this beautiful facility we have here now. But I thought it'd be interesting to give you a little background to show you how bad the facility was and what they had to do to try and renovate it. So this is kind of what it looked like back then. It had been boarded up and not occupied for decades and had fallen into disrepair, as I said. And these pictures were actually taken about 5 years before they did the destruction. So, you know, plants had started growing out of some of the windows and things like that. So it was significantly damaged. This is a picture of actually when they started the renovation. They started with the painting and everything. They replaced all of the windows, replaced a lot of the structural materials completely. They didn't completely gut it, reconfigured the inside though. They had to put all new electrical HVAC system in. So it was major, major renovations that happened. Here's a picture of the back of it. You can see the boarded up. You can see this is from '96. So it's really wasn't very, very bad shape. This is kind of what the inside looked like. You know, it's kind of a wreck, as you might imagine. A lot of work to do. Some walls were taken down because you're taking a house and making it into a medical clinic, which, you know, required significant renovation. So we now have a facility that kind of shows you, this is the main, was like the living room area. And it had been used, as I said, as a rectory, and they also used it for storage and that type of thing. But the interesting feature is when Dr. Stewart went to renovate it, they really wanted to retain a lot of anything that was architecturally significant. So the surround around the fireplace was retained, as well as that tile, which you can barely see, is Majolica tile, originally made here in Phoenixville. So that's been beautifully restored. This room is now a very nice patient waiting area, which for the past year or so has been empty. Unfortunately, someday, hopefully we'll get back to that. But the clinic's mission is very simple. We provide quality health care to the uninsured in an atmosphere that fosters dignity and respect for our patients. So there's a lot of people that don't have health insurance, and they just kind of are left by the wayside. And we just tried to do it in a way that doesn't feel clinical, or that they're accepting some charity or privilege. We want to make them feel that we care about them and give them very high quality healthcare that we possibly can. This kind of shows you the renovation that happened. This is a typical patient waiting room, and it's with bright colors, very cheerful, and with all the modern equipment available to it. So, I mean, you put in a first-class medical clinic. We have 6 of these patient rooms, 3 on the first floor, 3 on the second floor, as well as a mixture of offices as well. So it's a fairly sizable clinic. This is the nerve center, so to speak. This is the practice manager's office, where all of the records are kept, all the appointments are made, all the follow-ups and referrals are made. As you can see, we have paper records. You know, this obviously 20 years ago when this was started, that was kind of a thing, but there's a big move now towards electronic medical records. That's a real issue for us, not only in the cost and the work to convert these, but these systems like Epic, which a lot of the medical practices use, are very complex. And there's like 40 hours of training per person that does that. Well, in this room, we have the practice manager, and the other 2 ladies standing up in the blue are volunteers. We have many more volunteers than we have paid staff. We'll get into that a little more later, but the volunteers do all the scheduling work. They do the filing work. They do all this type of work. So we can't train every one of those people for 40 hours on a new system. So besides the pretty exorbitant cost of this type of thing, the difficulty in having enough paid staff trained to be able to handle the workload is really impractical for us. We have a laboratory as part of it. This is the lab area. It was one of our lab supervisors. We do a lot of simple blood tests here, pretty much a lot of the common ones, everything from pregnancy to simple blood tests, A1C, things like that. Most of our patients come and present with diabetes, hypertension, obesity, things like that. So a lot of the drugs we have are fairly typical for that. And the pharmaceutical companies do give us a supply of the common ones, nothing that's really expensive or difficult. But we have some donated pharmaceuticals here we can give to our patients. But any other drugs they may need or tests, they can go to Healthcare Access, which is a valued partner. And they enable our patients to have access to dental and vision care. So we're primary care. I mean, when we opened up, primary care meant, if you broke your arm, we'd go and set it. If you had a cut, we'd sew it up. We were kind of more of what would now consider an emergency care facility is how we started. But we've morphed into pretty much a family practice or primary care. So you go to your primary care physician and anything else you need is referred away to specialists. And that's kind of what we do now. And we were able to do that through the incredible generosity of Paley Hospital through their Charity Cares program. So our patients can get whatever type of diagnostic testing they need, as well as treatment up to and including heart surgery, if they live below the poverty level for free. And if not, they can get it in a sliding scale if they don't have insurance. And I'll get into that a little more in a minute too. So we can offer full services like a primary care does through what we can do in-house and through referrals. This is our nurse practitioner, Jackie. She's actually our associate medical director now. And she's an interesting story. Phoenixville, born and raised, and wanted to be a nurse, went to get her RN, got her actually her master's in RN, and she decided she wanted to be a nurse practitioner. Went back to school and got a nurse practitioner. And she did she did some mentoring here. She did some training because she lives right down the block. And she did her clinicals here, and then we hired her. So she's been fabulous. She grew up in the clinic. She loves the patients so much. She's so nurturing and welcoming. She kind of sets the tone for the clinic in general, because not taking health insurance, we can see patients as long as we need to. If we need to see them every day for a week to figure out what's wrong with them, we can do that. So the patients really feel cared for, and we try and make them feel like, we will do what we have to do to try and figure out what's wrong with you and help you get over it. So it's a very nurturing environment, a very family type environment. And people do say when they're treated here, they feel like they're part of a family. And certainly our staff, we feel like we're one big family here. It's a very close group. We also do a lot of training of students. This is a medical student who come in and they'll do rotation through the clinic, and we give them a lot of hands-on here, which is what they like. So anybody comes in as a nursing student or a medical student, they do the work and is supervised by our doctors. So very much a part of who we are. So there's a very important distinction when you say free clinic. We are what's officially called a free clinic, and we offer free primary medical care to anyone with no health insurance and who live below 300% of the poverty level. The chart's kind of hard to see, but if you can see the 300% in the blue there and go down to the size of the household, you can see what 300% of the poverty level is. So most of our families certainly qualify. All of them really do qualify to be under that area. They can't come here. That's kind of a cutoff. But you see the first column at 138% of the poverty level. That just kind of gives you a clue where the what type of poverty level, what 138% looks like. That's kind of the basic, and that's pretty low. So the difference between a free clinic and a federally qualified health center, you'll see some of these, you may not be aware that there's even two different types of free clinics, but there are. They offer similar services, mostly free primary care. But we have to, there's this designation called an underserved area, which is a government designation. And if you are in an underserved area, then you can open a federally qualified health center. That is a much more economically viable model than a free clinic, and I'll go into that. But a free clinic cannot exist it has to exist in an underserved area. So we we have to be who we are by law. We cannot be a federally qualified health center, and we cannot accept insurance. Federally qualified health centers do Medicare, Medicaid, private insurance. That's why it's easier for them to survive than us. And they can charge for their services based on income. We can't charge for anything. We have to be totally and completely free. And that does put a strain, because that means we have to raise every single penny through donations. As I said before, we have a small paid staff and a lot of volunteers. We have 9 full and 3 part-time staff members, volunteer physicians, medical providers. We have 28. These are all pre-COVID numbers. We hope to get back to these. And then volunteer nurses. You pretty much need a volunteer nurse to support every volunteer medical provider. And then volunteers, clerical and miscellaneous, we've got another group of them. So you can see we have, you add all those up, and we've got many times the number of volunteers as we do paid staff. And that's why we can afford to offer the wide variety of services that we have. We have some of the medical providers are cardiology, rheumatology, pulmonology, OBGYN. So it's a full different type of these are a lot of these physicians are either in the latter part of their careers or just feel they wanted to donate some of their time. So they come for free, but they're free of the restrictions of Medicare and other restrictions they're put on them by the insurance industry. So they love being here. So notable numbers. That's the point where I bring Beth in, because she knows the numbers better than anybody. So because she lives them and breathes them every day. So Beth, I'll turn it over to you, and I'll just try and stay a step ahead of you. I'll turn on the slides.
Okay, thanks, Lou. If you want to just put up all the numbers on this slide, just so I have them in front of me. So here are some of the notable numbers from the past 2 years. As you can see, the pandemic had quite a big impact on the clinic. Our patient visits were at about 60% capacity. As Lou mentioned earlier, our waiting room has been sitting empty. We cut down on the number of patients we were seeing every hour. So we would bring them in and then right to the exam room. We wouldn't let them, be together in the waiting room. In addition, we had a smaller capacity for new patients since we had to cut down on patient visits. We had to prioritize our current patients, so we had to cut down on new patients we could see. And then, as Lou mentioned, we also had to cut back on our volunteers just to keep the number of people in the building at any time at a minimum. Thankfully, this year we're bringing back a lot of our volunteers, both clerical and medical. And, we're hoping that our operations normalize a little bit, in this, as people get vaccinated, and we can start bringing back more patients, more volunteers. You want to go to the next slide? So as Lou mentioned, we are a free clinic, not an FQHC, which means that we don't receive any funding from the federal government. In 2020, we did have 575 generous donors, and the majority of those donors are individuals from the community, just individuals making donations, $10, $20, $1,000. We are so grateful for every single one of them. And here are some of our larger community partners. As Lou said, Mainline Health Paoli Hospital is huge with in-kind services, providing our patients with diagnostic consultations and testing. And then there are some of the other larger private foundations that fund the clinic. Can I go to the next slide? So here are some of our financials from 2019. 2020 kind of got turned on its head, so the numbers are not very typical for the clinic. Again, we're hoping that the financials kind of normalize, just like the patient visits. So here is kind of the breakdown of where we get our money. We do receive a lot from private foundations, but also quite a bit from individuals. This 20%, that's nearly $300,000 that we bring in from just community members like you who, are inspired by the clinic's mission. So this, again, we don't receive any funding from the government. So every dollar of this, we need to raise every single year. So it's, it's a big task. And yeah, every year it's uphill battle. And yeah. So here is kind of where the money goes after it comes in. 92% is spent on our program and our services. And then, 4% on development and 4% on management. One other thing I did want to note about the numbers at the top, the 4% fundraisers, again, that's almost at 0% for 2020 because we had to cancel our fundraisers, unfortunately. We are bringing them back this year. We have, or we're trying to have 2 signature fundraisers. In 2019, we had our very first field day, which was a lot of fun and it was a big success. We are planning that again for 2021. So that will be in September. If you're interested, follow along on our Facebook for more details, and we'll also have info on the website. So that's one of our signature fundraisers. We're hoping to do that every year. And then last March, it was probably the worst possible timing. Well, March 2020, that is. It was probably the worst possible timing for a first-time fundraiser. We tried to have our murder mystery dinner at the end of March and had to cancel it last minute, which is pretty much a nightmare for a development director. But we're hoping maybe we can do that again, do it for the first time actually, this coming spring. We'll see if another year will allow, like an inside event like that. But yeah, we are really excited about bringing field day back and seeing some of, the faces in person again at our fundraisers. And I think that's all I have.
Okay. This is just I wanted to close with what typical day looked like for the number of people that are typically in the clinic. This was pre-COVID. This is the all of the staff and volunteers. There's 6 people in the front there. There's 3 volunteer physicians there. Myself, obviously, Jackie, who's our nurse manager, now our associate medical director, and you see Beth hiding in there somewhere. So this was kind of the staff. I said, let's go out on the porch and take a picture of everybody that's here today. But it's a typical day then. So we typically have 25 people running, 20 to 30 people running around. So it can be a very, very crowded place, and it got kind of crazy, but it was great. And so we want to get back to that level of activity. We loved it. And our volunteer physicians really want to come back. The one standing right next to me is Dr. Bomsey. He's our volunteer pediatrician, and he's back already. So we just couldn't wait. So it's great to have them there. They give us a tremendous amount of help, and you get hooked here. Our volunteers, when they come here, they just fall in love with the place, and we fall in love with them. So it really is a wonderful place. So thank you for your time and everything, and appreciate your attention. And we are here for any questions you might have. So.
Great, Lou. Thanks so much. And Beth too. Thank you. You guys have come quite a long way in 20 years and hopefully can rebound after this pandemic situation. I just had one question. Are you accepting new patients at this time?
We are. We have gradually opened to that. We had put it on hold for a while, and then we started just doing it on a case-by-case basis. We haven't gone totally wide open yet, but pretty much if someone comes to us and says, I'd like to be a new patient, particularly if they have something wrong with them, we'll certainly do that. We never turned anybody away for any reason. If they really need help, they come in and get help. So that's the most important thing. We're trying to realize that our success depends on our success of being able to raise funding. So, we have to really make sure that our resources are put in the right place. But yes, we are.
Thanks, Lou. Anyone else with a question? Please feel free to unmute.
This is Lee, and more than a question, I just want to thank you. This was an excellent presentation, and sorry the crowd wasn't larger, but I'll spread the word as much as I can. I have been familiar with the clinic ever since it opened, but I learned a lot from your presentation, a lot of things that I didn't know. Dr. Stewart was my mother's doctor and then my wife's doctor. And she is an incredible person and an inspiration. And you can see her personality and her legacy in the clinic. And it makes me proud to be a member of the Phoenixville community, because it does what it provides such a valuable service, and not every town can do something like this, especially with all the volunteering and all the fundraising. When the clinic first opened, you kind of brought back some memories, because I was in that building before the renovations were done. And I don't have any health care skills, but I'm a reading specialist, and I asked Dr. Stewart if she would have any interest in providing books in the waiting room to kids, mostly when they come in, but anybody. And she said, absolutely. And so I managed to scare up a few hundred books, gently used books and some new ones. And every year since then, once a year, except with the exception of this past one, I've brought books in to kind of replenish that supply. And I'm wondering if that's something that can continue when you're fully open for business again.
Absolutely. Absolutely. That's great. Patients love it. We actually have some older books that maybe that the adults might like as well. Some people may be trying to struggle with that type of thing. So, I mean, yeah, it's great. We have them on both floors. We have a bookcase in each one with a variety of books in them. So yeah, we're all about that very much. And we really appreciate that. That's tremendous. And just another note on Dr. Stewart, that when she did this, she achieved nationwide recognition. She was on the Today Show. She was on CNN. She got a special award from the American Medical Association. So she is truly a celebrity. And it's funny because for Dogwood Parade, last Dogwood Parade, I guess we had, right, Beth? We got her a pickup truck. We put the clinic on, and we put a chair in the back of the truck and gave her a sash as the Queen of Phoenixville and drove her through the parade. And it was amazing how many people in town knew her and said, Dr. Stewart, we love you. We love you. So she's great. She was our medical director until about, maybe 10 years ago, not even that. And then she retired, and her son and grandson, I think, had moved to Florida. So she wanted to go to Florida. They moved back. So she moved back, and now she lives in the Newtown area. And she approached us about wanting to come back and volunteer, which is, oh my God, what a blessing that is. So she's here on Monday mornings usually. Sees a lot of her old patients. She's helped with our fundraising. She's just a rock star. And we're so blessed to have her a part of us now. So yeah, Dr. Stewart is strong and tough as ever, and still doing a fabulous job of treating patients. So she's our inspiration every day.
That's great to hear. And when it's safe to go back, maybe if it's okay, I'll stop in on a Monday and see if I can catch her in and say hello.
That'd be awesome. That'd be great. Love it. Love it.
My wife and I do, contribute to the clinic every year. It's not a lot of money, but we want to support it any way we can, and we will continue to do that, and we will absolutely spread the word.
Thank you very much. It's very, we have so many wonderful, loyal supporters like you. That's why we're still here. Wouldn't be here without you. So thank you very, very much. It's a wonderful community. I feel blessed to be a part of it. I've lived here 35 years, maybe. Beth is, Phoenixville girl, born and raised. So, I mean, we just love it. Love everything about the town. To me, the clinic epitomizes everything that's great about this town. So super place to be, and we feel very fortunate to be here. And thank you very much for this opportunity to speak with you all. It really was, we'll share it on YouTube. But if you got one day left, if you're really interested, Healthcare Access, our partner, is doing a fundraiser. And it's a karaoke fundraiser. And they solicited the nonprofits and the businesses in town to submit videos, which are now posted on the Healthcare Access HCAPhoenixville.org website. And you can vote for whatever organization you want. And it's $1 a vote. And so far, I didn't check that, lately, but we're really neck and neck with the Gateway Pharmacy. So we're doing pretty well on there. So we appreciate if you go see kind of a crazy video that we did. And we had a ton of fun doing it. Kind of epitomizes how much fun this crowd is. They really like to have fun. And it was a good stress reliever too, because we're so busy here. It's just insane. So, if you want to do that, that'd be great. Another way to show us support. We appreciate it.
Sounds good.
Any other questions, comments?
I'd just like to comment. I hope it can be heard easily. My name is Jennifer Weiss, and I work with Healthcare Access. And I just so appreciate everyone in the clinic and what you do. I love the video. I would encourage everyone to check out the video. Really, I don't know your staff very well, but I know that we have a lot of mutual referrals. And I just wanted to give a shout out as well. I so appreciate, in particular, the mammogram referrals we get from you. I just think it's wonderful that we are serving this uninsured community together. And I do live in Phoenixville. I live here as well. And I'm really honored to be a part of this. And I'm also really surprised, as I've only been working here in the office for over a year now. I'm interpreting prior to that with HCA, just how we rely on each other as nonprofits, how much we draw people together and in trying to build some sort of healthcare for people, really to give them the access they need to make it more comprehensive. So I really do appreciate all of you and what you do. So thank you so much.
Thanks, Jennifer. Appreciate that. Yeah, it's just amazing the partnership there and how wonderful it's been. So yeah, support healthcare access too.
I didn't even know, I had not heard of healthcare access, and I'm born and raised in Phoenixville, but I did learn about it at one of these community forums. So thank you, Mark, for setting that up. And I've learned a lot since attending some of these about all the resources in our town. And it's gratifying to know that there's so much available to people, because this is not an easy time for a lot of people in our area.
Phoenixville is truly blessed with these organizations.
Yep.
Especially the clinic. Thank you again, Lou and Beth, today for sharing the clinic story. And thanks everyone else for joining us today. All right, take care.
Take
Enjoy the
care.
rest of your day now.
Thank you.
Go on,
Thanks.
everybody.